Hello, and welcome to our broadcast. I'm your host, Beth Schenk, Executive Director of Environmental Stewardship at Providence. We're glad you're joining us today and watching the recording later. As a reminder, the information provided today during this event is for information purposes only. For any medical questions, please reach out to your primary care or healthcare professional. So let's begin. Today we are talking about waste optimization. And you may not know what that means, but you do know what waste is. We all touch waste every day. Just think about your house, think about your work, think about wherever you are, and how much waste goes through your fingers. So this could be recycled or compost or trash, or it could be hazardous waste if you use hazmat days at home. So in healthcare, this is a particular challenge. We create an awful lot of waste. And we have also created in a bold goal for climate, and that is to become carbon negative by 2030. And if you've watched some of these series, you know that. And our secondary goal, which is a little bit less well known, is about waste. And so we intend to send less than half of our waste to streams that are rather intense: landfill, autoclave, incineration. So to get from where we are today with so much waste, and it's very complicated, to this state in the future that we call waste optimization, that's what we're going to talk about today. And today I have three guests joining me, and they're my colleagues, and we work together a lot. Jeff Glass is the Senior Technical Manager for Energy and Environmental Stewardship at Providence. Mike Geller is the Senior Program Manager in the Providence region, or in the Oregon region for Providence for environmental stewardship. And Oriana Turley is the Analyst and Program Coordinator for environmental stewardship at the Providence system. So let me just set the stage a little bit with a few facts, and then we'll dive into a discussion. First of all, healthcare waste is really complex. It's highly regulated. We have about 30 different waste streams. It's expensive and sometimes hazardous. So we have good reason to want to conserve and reduce the amount of waste that we're creating. And that's an enormous amount. Healthcare creates an enormous amount of waste. We know that among hospitals that are working on this and are reporting to a database through an organization called Practice Green Health, the average is 29 pounds of waste per day, per patient. Now, it's probably higher than that amongst the hospitals that aren't trying to reduce it. A family generates about 5.5 pounds of waste per day, which is still a lot if you think about that every single day of the year. But in healthcare, at 29 pounds per patient per day, it's enormous. Why is that? Well, we use a lot of disposable products that are used once and discarded, and we're working on that. And also we know that sometimes there is harm that's caused by waste. Waste is an indicator of overuse, and overuse of resources drives carbon emissions upward. So one of the ways we're approaching our carbon goal is to reduce the amount of stuff we use, which then reduces our waste as well. So how will we do this across the enormity of Providence, which is 52 hospitals and over 1,000 clinics spread out over 7 Western states? That's what we're going to talk about today. And to get us started, I'm going to turn to Jeff. And so, Jeff, will you please tell us a little bit about your role and what you do, but then also tell us about waste optimization. What are we planning?
Thanks, Beth. Yeah. Hi, everybody. My role is to develop programs in our built environment to support our carbon negative goal. And one of those programs that we're going to talk about today is our waste optimization initiative. How we have organized around this initiative is to create a guideline, which we call a playbook, that describes best practices in waste management across each of those waste streams that Beth talked about. And I'm going to orient you just a little bit to what those waste streams are, a little bit more detail. So the three waste streams that currently make up the majority, and we're trying to get down below 50%, are those that go to landfill. Think of that in your home. The infectious waste, which we also call biohazardous waste. And then hazardous waste, which is non-infectious and tends to be in the form of chemical or pharmaceutical wastes. So those are the big three that we're really, frankly, trying to minimize in favor of the following waste streams: maximizing recycling. And in the recycling category are commingled. You might think of your recycle bin at home as a commingled. We also have confidential paper, reprocessed supplies and equipment, where some certain categories of our supplies and equipment are cleaned and remanufactured, construction demolition debris, electronic waste, medical equipment that can be reused by others, and plastics. That's all in the recycling category. Another big category of waste is our food and yard waste. Also, universal waste, which includes things like light bulbs and batteries. Donations is a very interesting area, such as medical supplies that we can't use any longer. We collect those and send those to internal and national organizations that can use those, including some of our medical supplies are going to relief efforts in Ukraine right now. Food donations to local food shelters where it's permitted, furniture, and the like. We would love to see that be a growing area of waste stream where we can put that waste to beneficial use. And then finally, the concept of source or waste reduction. And that is putting together practices that minimize the creation of waste in the first place. As an example, cleaning and reusing plastic shipping containers, or reusable dishware, or launderable sterile gowns are three examples of what we refer to as source or waste reduction. So really, waste optimization is finding those beneficial reuses of waste and minimizing what we send to landfill, incineration, or autoclave sterilization. In terms of our approach to our initiative, this year in 2022, all 53 of our ministries are going through a waste optimization process defined by this playbook. And at the end of 2022, we will have action plans to work from to make sure that the waste goes to the right stream. And then in 2025, we plan to have all those actions complete so that we can be on the course to this 50%, less than 50% to landfill, incineration, and autoclave by 2030. So with that, I will turn it back to you, Beth.
Thanks, Jeff. Do you have any thoughts so far about how it's going?
Well, we're sort of in our infancy, having published this guideline and given this direction. So right now we're spending a lot of time with internal communications, and a couple of prototype sites have started in on a waste assessment and their preliminary action planning, and appears to be going well. It seems as if the guidelines that we created are understandable and usable. So we're looking forward to that growing as the year goes on to meet our goal of having those plans done by the end of the year.
Super. Well, I sure know that in the years of doing this work, very often the questions that people ask us about are waste. So I think it's people feel it, they touch it, it's top of mind. Thanks, Jeff. That's super interesting, and I'm keenly interested in what happens, as are you. All right. Well, let me move to Oriana. So, Oriana, I know you're spending a lot of time in analysis and in the data, and so tell us a little bit about your role, and then talk to us a bit about the data collection related to waste.
Yeah, thank you, Beth. I am an environmental stewardship analyst and program coordinator. So part of my job is to collect and organize waste data that feeds into the WEAC scorecard. And the WEAC scorecard, as some of you may know, is the end product and user interface of our data collection efforts. It's an interactive program where people throughout our organization will be able to go and view data and run site comparisons for waste and also other categories that create carbon emissions. Our environmental stewardship journey must be rooted in data, and it gives us a tangible way to track our progress, communicate that progress to others with efficiency, but also credibility. And our data collection efforts are ambitious, as Beth said, and truly data is the backbone of our environmental stewardship efforts. We have been working to establish a 2019 baseline for carbon emissions across our organization. And it is a monumental task to find, collect, and organize 3 years of backlog data in each of the WEAC categories. We have chosen our acute care ministries as a starting point for this data effort. And just to give you an idea of our process, I'm going to give you a few examples on how we collect this data. At times, we're able to work directly with our vendors to generate site-specific reports. This means we can get one massive report that shows cost and weight, for example, for an entire acute care facility. Other times, we have to find, collect, and manually process thousands of invoices to find that same type of data. And after collecting the bulk of it, we then put it into the WEAC scorecard where normalizing factors are applied. And we can compare sites apples to apples by waste stream. For example, we can look at biohazardous waste based on if it's incinerated or autoclaved then landfilled, and see the difference in carbon emissions and the cost for each process at a particular site. And this allows us to really hone in on sites that have values that perhaps are far from expected, either low or high. And we can go in and investigate further into why a particular site perhaps has an exponentially higher waste per adjusted patient day, for example, than another site. Waste is particularly complex, as Beth mentioned, and so to have a tool that gives us insight from the facility level all the way up to the system level on what areas need the most attention, we can then be extremely efficient in identifying projects that will have the greatest impact, both for carbon emissions and for cost. We definitely believe that knowledge is power when it comes to environmental stewardship, especially, and it's very important for us to know what happens to our waste at the most granular level possible. If we understand where our waste goes, we can work efficiently on reducing costs and emissions and understanding the current picture, but also knowing how waste should properly be segregated is essential in order to educate our caregivers on how to get the right waste to the right stream at the right time, because that is really key to our success. This is just a glimpse into the complexity of this process, and there's a lot of work to be done, but we are very proud to have made such incredible progress these past few years.
Thanks, Oriana. Yeah, it really is complex, and you've touched on a number of reasons why. And to add that to what Jeff was saying with all those waste streams, we think about, we describe it as having 30 waste streams. Some of them all fall under recycling or all fall under infectious waste. But when we break it all out, it's just an enormous quantity of data, especially when it comes from invoices. If we think about 30 waste streams every month for 50 hospitals for years, it's kind of overwhelming. And I want to just throw out there that we do also, for some of those waste streams, particularly the landfill and compost and recycling, we have the help of our partner, Schneider Electric. So Schneider helps to pull in, because they pay a lot of those invoices straight, the bills themselves, which is another super helpful feature. And then they load that into their resource advisor database, which then feeds by API over to our WEAC scorecard. In case there are some tech sort of folks out there who are interested in that process, it's been utterly fascinating to watch the scorecard be built and to work with our fabulous team, if I may point out, in Hyderabad, India, the Providence Global Center. Thanks, Oriana. It's quite an experience. All right, well, let me turn to Mike Geller. So Mike has been with Providence for a long time, and Mike, I ask you first to tell us a bit about your role, and also to talk about one of the most exciting things that Providence has ever done in waste, and you've been the leader of that for a long time, and that's the Providence Recycling Center.
Yeah, thanks, Beth. Yeah, I started my career at Providence in the environmental stewardship work around 2004, and have been doing it. I took a short break, came back to this meaningful work. I was drawn back to it. In my role, one of the biggest projects right now is this waste optimization, to where, as Beth said earlier, we're working to send less than 50% of our waste to landfill or incineration by 2025. One of the blessings, if you will, that Providence, Oregon has is we have a commingled recycling program. This program allows ministries to recycle film plastics, rigid plastic, packaging material, block styrofoam. All this material otherwise would be landfilled. This commingled recycling is sent to a recycling center that Providence operates here in Portland, Oregon. The recycling center is staffed by adults with disabilities that actually hand sort all the recycling in the different streams. And without this center, this would all be landfilled. And not only is Providence having the benefit of being able to recycle all this material, but we're also providing jobs to the underserved in the communities in which we live and work. So it's a great program. So then it gets separated into the different streams, and then we actually partnered with a local minority-owned woman business that's a plastics processor that actually processes the plastic in Portland into a source material that's later used in the injection molding industry. So it all stays domestic, and it's all processed within 5 miles of our recycling center. And if looking at numbers, and Oriana hit on the data piece earlier, it's so important. And looking back at 2021, our ministries actually sent around 600 tons of recyclable material to the recycling center that was then processed. Um, yeah.
Great, Mike. That's
Yeah.
super amazing. Did you have more to say?
No, that was all,
No.
Beth. Sorry.
Okay, you bet. Well, your timing is good because there was a question that came in about plastic liners in pitchers. Now, as a nurse, and Oriana's a nurse too, we know about this and how frustrating it is in healthcare to encounter all this plastic that is used once, discarded, and much of it is film plastic or non-rigid plastic, which for the rest of us is not recyclable for the most part, Mike. So what you have solved in Oregon, this is for some of your plastic wrap and all of those clinical devices like bedpans, urinals, graduated cylinders, the stuff that recyclers don't take because they may think it's medical waste, and that's by law probably that they can't take it. But what you've managed to do is set up this intermediary where it's sorted and properly categorized, and you sell it straight to a plastic purchaser. So you've really gotten around that issue. Do you anything you'd want to add about that?
No, it's the partnership. I mean, they inspect the material that we send them. We densify it. We bale like our blue wrap and our film plastics are baled. A lot of the rigid plastics, because it's hand sorted, is why they have agreed to take material
Mhm.
from a hospital.
Mhm.
If it wasn't hand sorted, there's always that potential of contamination. And because our staff sort it by hand, it eliminates the risk of contamination. And
Yeah.
obviously, the green teams and all like-minded people doing the training or having these discussions in the hospitals, so that we don't get contamination at the center to potentially cause harm to the staff.
You bet. It's just so great, and it solves a big problem that frustrates a lot of us that we can't do anything with those plastics. So I often am saying, "Hey, we need an Oregon Providence Recycling Center in Southern California, and we need one in Western Washington,
Let's do
and
it.
other health systems across the country need them too." So great work. Now there are two hospitals that have currently already made our goal. So I just wanted to touch on those. One of them is St. Patrick in Missoula. And Oriana, would you tell us a bit more about that?
Yeah, absolutely. So St. Patrick's Hospital in Missoula, Montana has met our 50% waste reduction goal annually since 2019, which is pretty incredible. It has had a robust waste reduction effort for many years and has all the major pieces in place. For example, unused, unopened, clean medical supplies are collected and sent through our medical supply recovery organization, where they are sorted and sent to domestic and global partners in need of quality medical supplies. Partially used items such as tape, Coban gauze, wipes, they're collected and distributed through the local Missoula Animal Shelter, which is pretty incredible partnership. And just this last year, St. Pat's significantly increased compost collections, collecting almost 300,000 pounds of compost for 2021, which is nearly triple that collected for 2020. And Montana doesn't have a robust recycling system as a region, but St. Pat's has really come up with creative ways and partnerships to get the waste into the right waste stream, despite that lack of regional infrastructure. And it really does serve as an example for us that big changes can be made through local effort, despite regional infrastructure. So we're very proud of this site.
Thank you. That's really cool.
Thank
And
you.
you're right. The difference between a large urban area and a kind of small mountain town where you have to get 500 miles to major manufacturing, pretty much, it paints a different picture, but that's a great example. So,
Mhm.
Mike, in Oregon, another site has achieved this goal, and that's Hood River Memorial Hospital. That's a smaller hospital, but it's in a high traffic zone, I guess. Tell us about that program.
So yes, our Hood River Hospital is a small critical access hospital in Hood River, Oregon. It's about 60 miles east of Portland, but it's on a major highway. And as Oriana touched earlier, there's minimal local recycling available. We do food waste there, but as far as any other plastics or any other recyclables, there's just no market. So there's no programs locally. So we actually collect recycle. We have been collecting out there for probably 10 years. So they're pretty good at what they do. And it's brought back to the recycling center where it is sorted by the staff and sold off just like the rest of the other ministries. The exciting part for Hood River is in 2020, Providence Hood River actually met their 50%, less than 50% to landfill or incineration. And the hope is to take the great work being done there and mirror it to other locations so we can get all 8 Oregon hospitals to that less than 50% to landfill.
Well, it sounds like you're well on your way. And I just like the fact that those are two very different hospitals, but neither of them are in major urban centers. We had a question about Oregon, Mike, come in, and I want to ask you, and that's how would satellite clinics in the Portland area get involved?
Great question. Um, and it's not one that we have not talked about. I think if you look at this in phases, phase one is to get the hospitals um, up and going. They're actually up and going, sorry, up to that 50% mark, and then start looking at some of the larger satellite facilities. Transportation becomes an issue. There's lots of things to look at, but it's definitely phase two of our program to be started later this year.
Terrific. So more coming, and hang on. There are also a couple of questions about getting Providence. I think these are about Providence hospitals engaged. So whoever's asking the questions, please help us. Talk to people about this. Help spread the word. Not only that we have a major carbon goal, but right now we also are focusing 2022 on this waste goal. So we're working it from the inside and from the top and bottom, but really we need as many people to get engaged as possible. So let me see here. I have another question, Jeff. I'm going to ask you about cost. So we know that this is really something we thought a lot about with the playbook. But the question is, at my hospital, I'm told that we can't recycle because it's too expensive. How can I deal with that?
Thanks, Beth. And if I may double back and just compliment Mike's answer on the non-acutes with something we've been working on is a survey of clinics, which is a bit of an overlap with the hospital work that we've talked about here in terms of understanding which clinics recycle and which don't. That active survey is in place right now, and as Mike said so well, we intend to take that information and start to target in the middle of the year opportunities that exist in some of our larger clinics to improve recycling. The other thing I would say in direct answer to the question that was asked is reach out to your property manager and encourage them that you want to see recycling or you have ideas for waste optimization. That is in their responsibility to help develop those programs. So I would encourage you to make that communication. Back to the cost, I think that once again, everything seems to be coming back a lot to data. So as we gather quality data, it helps us to understand cost per pound of these different waste streams. And in many of our municipalities where we have compost programs or mature recycling programs, we're seeing that the cost of those waste streams can be less expensive than the landfill, and frankly should be less expensive because that waste stream has further utility in its life. Uh, so it's certainly going to vary by site, but I would say my experience looking at the data, more sites probably have a lower cost for those composting and recycling opportunities than landfill. And I believe that those costs are going to get further and further apart over time. So that's really part of waste optimization is to understand not only the most environmentally preferable means of treating that waste product, but also the most cost-effective way for Providence.
Great. Thanks, Jeff. And we've talked a lot about that we track poundage and also cost. We also track the carbon impacts, so the greenhouse gas pollution coming from waste, especially for the heavier, those waste streams that are treated more intensively. So landfill generates a lot of greenhouse gases. Our incineration does, and so does our autoclaving. So that's why we're trying to reduce those amounts, because they create the greenhouse gases. All right. Now, speaking of data, another question. Oriana, you were talking about the complexity of managing the data for waste. It comes in from so many different places. How do you keep it straight and also check for accuracy? What's the QA process?
Yeah, so this is a great question, one that I think about a lot, and it's a very important one. It's a challenging process, and thankfully, as you mentioned, Beth, we work really closely with the global Providence team, which includes very talented software engineers and data analysts, and they help us inspect all the data we collect to identify inconsistencies. We are also working to build automated checks into the data digestion program, which takes the raw data that we find, pulls it into the correct WEAC categories. So we'll be alerted if a particular data set falls outside of expected parameters. This allows us to hone in on those areas that don't pass inspection, to take a closer look, meaning that we reach out locally to vendors and ministries on the ground to, as we say, ground truth the information and make sure that we are painting an accurate picture of what's actually happening on the ground. Improving our data is always going to be an ongoing process, one that we welcome because it's so important that we have as accurate of data as possible. And then in turn, we can have a clear insight into what work most needs to be done. The beautiful thing about the WEAC scorecard is that when we put the data in and it's completely digested, normalized, and available to view in the scorecard, we can easily run site comparisons and identify outliers at a glance. And this really simplifies how we identify sites that need improvement, but also sites that are doing outstanding in their waste optimization efforts. And we can look to for examples for the rest of the system.
Super. I agree with you that the data tells the story. So we have to have it tell the right story.
Yeah.
Okay. So we just have literally 3 minutes. It goes so fast. Mike, there's a question about infectious waste. What happens to it?
It depends on which stream it is. There's multiple streams in the infectious waste world. Typical, because Providence uses reusable sharps containers, the waste that goes in sharps containers is actually incinerated. Regulated medical waste goes to autoclaves. So it's autoclaved, and then hazardous waste as well is collected and sent to hazardous waste incinerators.
Great. So the medical waste itself, the infectious waste itself, is safely treated. And I heard you kind of hint at the idea that it has to be segregated properly. So that's why if people have worked in healthcare, you'll see yellow bins for chemo waste, red bins for regulated medical waste, blue bins for our sharps, black bins for hazardous waste, little putty colored bins. That's what Providence uses for narcotics waste. So you can see that particularly in the clinical world, you have to not only know what supply to get to deliver your care, but what do you do with it when you're done? And this is part of practice. This is an important aspect. Okay, I think we can fit one more question in. Jeff, how if what we're saying is true, that everyone is touching waste, how do you get everyone involved? This is through that waste optimization plan. How do we really get everyone involved? Oh.
It's really about taking a systematic approach to this issue. Given that so many hands touch it, it really requires the work is at each individual site, requires engagement of the leadership, including executive leadership, and the numerous departments that have responsibility. So it's a different way of thinking about looking at this product at the same level that we look at products that come in through our loading dock, and that is just a different way of viewing it. And it's the description of how we go about doing that is in a chapter we've written on leadership, and it includes processes for reporting and evaluating and optimizing the waste. So it's a team effort at each individual site to assure compliance and optimization.
Here, here. Thank you so much. Well, we really are on our last minute, and I just want to amplify a few things I've heard. One is waste doesn't just go away. It goes to a variety of places. It's treated, it's collected, it's expensive. It doesn't just disappear. So anytime we have waste, it's going somewhere, and it's up to us. We're the person who puts it in the bin is the last person who's going to touch it. No one's going to go sort it for us. So that's an important thing is segregation. I think just like Jeff said, we're talking about a culture change about waste, really, really changing the dial from we use what we use and the waste is just something that doesn't really matter. Instead, in looking at waste is an indicator of how efficient or inefficient we are with what we're using and how much we're using. So we're really asking people to switch their thinking about this. And this requires an emphasis on source reduction. So Oriana talked about this, as did Jeff, to not bring in what we don't need to have. And soon in Providence, we'll be really working with clinicians more directly in the next couple of years to start to identify what could they eliminate in the products, because that's where the waste comes from, is the materials that we bring in. It's complex and it's a different way of thinking for our whole culture, not just in Providence. But it is so interesting. Once you get into waste, I call it the gateway drug for environmental stewardship, because it's fascinating, it's complex, it's political, it's kind of emotional if people care about it. It's very gripping. And also it's something that we see and touch every day. So it's a good reminder to when we think we want to live in a way that's compatible with a healthy planet, then we need to pay attention to waste through that lens as well. So I've said enough. So thank you so much to Jeff Glass, Mike Geller, and Oriana Turley for joining us today. And thank you all for listening and sending in your questions. It really helps. To learn more about our initiatives, programs, and services, or ways to donate, and in fact, I'll just mention that we now have a national foundation, including with 6 focus areas, one of which is environmental stewardship. So if you'd like to help there, please check that out. If you need help with your health, of course, then please visit providence.org. Make sure to follow us on social media. On Twitter, it's Providence, and on LinkedIn, Facebook, and Instagram, it's Providence Health System. Thank you so much.